Hi, my name is AJ and I am a nurse here at the Ward Institute. Today we're going to talk about aftercare instructions for post-op rhinoplasty or septorhinoplasty. After you have any work done to your nose, it's totally normal to have bleeding that can last up to a week. Most of the heavy bleeding kind of subsides within the first 24 to 48 hours, but it is not uncommon to have clots that both kind of come down the back of your throat and out of your nose. Once you're taken back to surgery for the rhinoplasty, the surgeons will begin your procedure. Generally, we use general anesthesia for our rhinoplasty patients just to kind of protect your airway from any additional bleeding. After surgery, you'll wake up and you will have most likely internal splints, which are sewn into your nose, right into your septum here. Those typically stay in for 7 to 14 days. I would say probably about 80% of our clients have their internal splints removed within the first week. And then you'll also have an external splint on the outside or an external cast on the outside of your nose to kind of protect you from any outside elements. Additional dressing you might have under your nose is a little mustache gauze, which is just a piece of gauze that's rolled up to collect any drainage that you may experience immediately following surgery. If you do not have any drainage on that dressing, you're welcome to get rid of it. Following surgery, you'll take your prescription medications that were prescribed for the surgery as directed on any of the bottles. Majority of the pain that patients experience after surgery is not very sharp. It's more of kind of a dull, achy pain from swelling in that generalized area. So things like ice and compression in that area can be a good way to get rid of some of that pain. Ice also does a great job of helping inflammation and swelling go down as well. Starting the day after you have surgery, you'll clean your incisions with generalized hydrogen peroxide and a Q-tip. And what you're going to do is you'll dip that Q-tip into the hydrogen peroxide and clean each one of the entrances of your nose several times to get rid of any kind of crusting or scabbing in that area. Once that area is clean, you'll apply the imupuricin ointment, or you can also use Vaseline or Aquaphor into that area. Our goal is to keep all incisions clean and well hydrated with that ointment. We always say kind of scabbing equals scarring. So we want to keep them clear of any debris and nice and moist so they can heal properly. You'll do this cleaning 3 times a day. 3 to 4 times a day if you can, at least for the first week or as those incisions heal. Once we see you at your 1-week post-op appointment, we'll go over any additional instructions you may have to keep that area clean. Swelling can be a very normal thing after surgery. I find that swelling generally has a tendency to kind of peak around days 3 through 5 after surgery. Around a week, you'll start seeing some of that swelling come out of the area, but you may also experience bruising. It's not uncommon to have some bruising underneath the eyes and just swelling and puffiness, as well as some swelling in the upper lip after a rhinoplasty as well. The majority of that post-surgical swelling is typically a lot of the noticeable swelling is resolved within 4 to 6 weeks, but it can take up to 9 to 12 months for the entirety of the swelling from the procedure to kind of fully leave your face and be considered fully recovered. We recommend after you have surgery to sleep in an upright, about 30 degrees in a midline position with your head in a neutral position. Falling asleep on either one of your sides of your stomach can actually be detrimental to your healing. So we like you kind of propped up and then a neutral midline position so that you don't have swelling on one side versus the other. I see a lot of questions regarding bleeding, and like I said, it is totally normal throughout the healing process to have bleeding that can last up to a week after surgery, but typically resolves or lessens significantly within the first 12 to 24 hours after surgery. You may experience some large blood clots that come out. Times that it would be to notify our office or get emergent medical help is if that bleeding is continuous and constant and not stopping. If the mustache gauze that's underneath your nose starts to fill and you're having to replace it 3 to 4 times an hour, that's a good time to call our office and let us know that you're experiencing excessive bleeding from your nose. We also get a lot of questions regarding the internal splints in the nose and the external cast on the nose. Our goal is to make sure that those internal splints and the cast on your nose stay in place for the first 7 to 10 days after surgery. If you notice any dislodgement or any movement from the internal stents in your nose, or the cast has actually come loose on your nose, please notify our office and we can direct you appropriately how to fix those things.